of surveys, sampling approaches, topics, level of representativeness, and so on. And we'll find out more today. And experience has shown that in addition to traditional and these most needed face-to-face surveys, the National Statistics Office need to modernize and incorporate different modes of data collection in their portfolio, not just during the pandemic or emergency times. And then using phone surveys as a standard NSO tool gives the opportunity for regular monitoring and rapid adaptation of the data collection in a time of shock in particular. So our speakers today will present methodologies used in surveys conducted over the phone and supported by the World Bank and UNICEF. So as you would have seen in the flyer, we have 4 prominent speakers for this event, and forgive me for pronouncing their names, but Mr. Talat Kilik from the World Bank, Mr. Tunde Abtsi from the National Bureau of Statistics in Nigeria, Mr. Badav Bakhmunk from the National Statistics Office of Mongolia, and my colleague, Ms. Tatiana Karolak from the UNICEF headquarters in New York. Let us quickly just touch on a few housekeeping issues. All speakers are requested to limit their presentations to 10 minutes or under so that we have sufficient time for questions and answers at the end of all 4 interventions. The event is being recorded, as you would have seen, and it'll be made available on both the UN and ESCAP as well as UNICEF websites. Online participants are kindly asked to mute their microphones and switch off their videos for bandwidth issues. And also, the colleagues online, feel free to put your comments into the chat so that the presenters will be able to address them at the end. And then we will also have an opportunity for those colleagues in the room to ask questions. So with this, let me invite our first speaker, Mr. Taleb, who is a senior economist at the World Bank Development Data Group. He is a team leader of the Living Standard Measurement Study Program, or LSMS for short, and the coordinator for the LMSS high-frequency phone surveys. He's also a member of the core team of the World Development Report 2021 on Data for Better Lives, and his research focuses on poverty, agriculture, gender and low and middle income countries, as well as survey methodology to improve the quality, timeliness, and policy relevance of household and farm surveys. So Mr. Taleb, welcome, and over to you. Hopefully you can keep it within 10 minutes. Thank you.
Okay, thanks so much. Karen, can you hear me?
Yes, thank you.
Okay, excellent. So happy to be with you today, and thanks for being here in person, also online. Today, I'd like to talk to you about our work as part of the World Bank Living Standards Measurement Study to inform country-level monitoring and decision-making, primarily during the pandemic, through phone surveys, technical assistance, and impact monitoring. So as you know, with pandemic-related disruptions to face-to-face surveys, there has been a surge in phone surveys to fill data gaps. Since 2020, we've led several initiatives related to phone surveys within the World Bank. We've led working groups to provide rapid guidance at the onset of the pandemic, as well as survey tools to operationalize phone survey systems in more than 100 countries. We also channeled funding and remote technical assistance to monthly phone surveys conducted by national statistical offices in 7 sub-Saharan African countries. And over the course of this period, basically starting at the onset of the pandemic, around April 2020 through November of 2021, which we termed to be phase 1 of this program, we've implemented 66 survey rounds amounting to some 130,000 interviews across these 7 countries. And these phone survey data are public on the World Bank microdata library, and I hyperlink that on my slide here. And going forward, basically, as we're speaking and through 2023, we're expecting at least 6 additional rounds per country. And our experience with the first phase of this program has been distilled in a food policy article, which is open access. And I encourage you to take a look. We basically present an overview of options for phone survey design and implementation, and provide recommendations for phone and mixed mode surveys to be a mainstay in low and middle income countries, primarily based on our experience with the high frequency phone surveys in LSMS supported countries. And this particular article provides a wealth of, I guess, information regarding basically empirical details of the implementation, interview durations, basically the questionnaire setup, fieldwork setup and supervision, costing, and other details that survey implementers may provide. Survey providers may find relevant. Across these surveys, there are two innovations I'd like to highlight. First, LSMS supported phone surveys relied on pre-COVID-19 nationally representative household surveys as sampling frames for phone numbers. And the pre-COVID-19 survey data were used to counteract both coverage and non-response biases that are common in phone surveys. We've demonstrated the utility of pre-COVID-19 survey data for a bias adjustment in both household and individual level analyses of the phone survey data. And there are two articles here that I hyperlinked that you may find of interest in this regard. And the same households that we have been basically interviewing over the phone are due to be visited in upcoming face-to-face surveys, enabling more comprehensive analyses of COVID-19 impacts, actually including in Nigeria, which you'll hear the presentation of starting in July of next year. And the second innovation that I'd like to highlight is that as the pandemic unfolded and the policy priorities evolved, we've designed and have been implementing specialized questionnaire modules to respond to changing data needs, including on labor mobility, economic sentiments, vaccine hesitancy and uptake, to name a few. In parallel with our support to phone survey design and implementation, we've implemented several other activities to monitor and strengthen NSO capacity during this period. First, in partnership with the UNSD and Paris 21, we've implemented 4 rounds of the global COVID-19 survey of NSOs to monitor NSO operations and needs during the pandemic. And the last round of that was implemented about a year ago. Second, under the aegis of the Intersecretariat Working Group for Household Surveys, we released a technical guidance note on planning and implementing face-to-face surveys under COVID-19, and also released a technical note on remote technical assistance provision for surveys, again, also informed during this period by our experience with the phone surveys, since we could not travel by and large to our client countries. And we've also disseminated several guidelines and tools that are, again, open access for designing and implementing phone surveys. And finally, we provided hands-on training to African NSOs that are the implementing agencies of LSMS-supported phone surveys. And we designed and conducted a remote training course on phone surveys, which is also open access and has several modules that you can take your own time. And this remote training course was basically was provided to 120 trainers across 7 regions. In doing all of this, obviously, one of the key objectives of our program was to also produce analytical products regarding responses to and impacts of shocks. And in this area of work, we paired phone survey data with pre-COVID-19 face-to-face survey data for the same households for rigorous monitoring of these responses and impacts in several domains. So I'll highlight a few of these headline results tied to specific analytical products, which I also hyperlinked here. And at the bottom of the slide, you can take a look at our webpage that has a more comprehensive list of our working papers, journal articles, and other resources. On labor impacts, we've seen that at the onset of the COVID-19 pandemic, significant share of workers lost their jobs and that women, and particularly workers in urban areas, were more likely to be affected. However, a year later, based on a more recent analysis of the survey data, these inequalities appear to have disappeared. On income losses, we've seen that across Ethiopia, Malawi, Nigeria, and Uganda, 256 million individuals, or 77% of the population, lived in households that had some degree of income loss at the onset of the pandemic. And we have shown that households with income from non-farm enterprises, which are overwhelmingly informal activities, were most likely to report an income loss, both at the onset of the pandemic, but also in the longer run, based on the analysis of additional rounds of phone survey data. On food insecurity, we've seen that over 105 million individuals across these 5 countries in Africa were impacted by moderate or severe food insecurity at the onset of the pandemic. But food insecurity has gradually declined across these countries during the following 12 months, but we're now monitoring those trends more closely again because of the Ukraine crisis, and again some of that work, also based on the later rounds of the phone survey data, are hyperlinked on this slide. And lastly, I'd like to highlight our work on vaccine uptake and hesitancy. We've seen that in the 6 countries we have used high-frequency phone survey data in and implemented these modules. The COVID-19 vaccine acceptance rates were quite high, with at least 4 in 5 people willing to be vaccinated in all but 1 country, and those acceptance rates ranges from nearly universal in Ethiopia to below what would be likely required for herd immunity in Mali at 64%. So some quick concluding thoughts for us. So we've seen obviously phone surveys to be feasible and useful during the pandemic, but the continued use of these systems for routine and crisis monitoring has several requirements. First, we need to collect more systematically phone numbers as part of upcoming face-to-face surveys. And both countries as well as international partners must sustain investments in NSO, IT infrastructure and capital and human capital to ensure sustainable use of mixed mode surveys. There's still significant scope for further developing but also consolidating guidance on phone survey tools and protocols in low and middle income countries. And lastly, it'll be beneficial to accelerate methodological research to basically improve survey design, phone survey design and implementation. And these methodological research topics, some of which I identified here, are areas that we're still in the process of working through. So with that, I hand it over to you, Karen. Thank you so much.
Wonderful. Thank you so much. It was very stimulating, especially the innovations in the phone surveys and the approaches you're taking to monitoring responses to and the impacts of the shocks. I'm sure participants may have some questions, and they can post them into the chat so that you can then answer them after each of the panelists have finished their interventions. So now let me invite the next speaker, Mr. Tunde, who is a professional sampler and statistician, and currently the Director of Statistics at the National Bureau of Statistics in Nigeria. Having served in different departments over the years, he has more than 30 years of experience in a wide range of projects. He holds a BSc in Mathematics and Statistics from the University of Lagos, as well as other professional certificates in poverty policy and practice, data analysis, statistical computation and report generation, and more from both Nigeria and abroad. Mr. Tunde, welcome, and over to you to try to keep it to 10 minutes. Thank you.
Yeah, thank you very much. Good day, everyone, both morning, afternoon, and evening. As we just heard, we are trying to share the Nigeria experience, and we see how it goes. Next slide, please. Okay. You can see from the slide that we have there, it's obvious, just as the Talib have said earlier, it's less expensive in terms of phone survey from what I've seen based on what I've been doing before. And we have seen that it's a unique opportunity for us to see how Nigeria coped within that period, because it was a global issue and everybody was facing so much problem, but people need data. And within that time, we were able to get this through this phone survey. And we got some things that are fascinating to everyone to see. Next slide, please. Yeah, well, the historical, how we implement it, interestingly, we have it in two phases. And luckily, the first phase happened within April 2020 to April 2021. It was in 12 rounds. We take it every month. And you can see the sample size, 1,150 households were interviewed within the period. After we've seen how it works out, the World Bank, in their wisdom again, now thought we should do second phase, which entirely have to be the project director for them for the two phases. So interestingly, the second phase, we are on it now. As I'm talking now, we just finished the 5th round and we are going to 7th round. So hopefully by next month, we'll be going for the 6th round. And by November or thereabout, we'll go for the last round, with the 7th round. And doing all these things is not done with MBS alone. We have a partnership with the Million Big Foundation and the UN agency, that's USAID, including the World Bank themselves, who actually are bankrolling the whole project. Next slide, please. Yeah, if you see the innovation that we see from the phone survey, it's a very interesting for us to know that the same, in Nigeria, with the help of World Bank, we have been doing the what we call panel survey. That's longitudinal survey, going to a particular household over a time. And interestingly, we started from 2010. And as it is going to be, I happen to be the person manning from 2010 up to date. So we have done up to 4 rounds, what we call phases. We call it wave. Wave 1, wave 2, wave 3, wave 4. So we're just planning for 5th wave now, which hopefully will come up next year. But what I'm trying to say is that is from that place, you're able to get the sample size. I mean, you're able to get the frame, which you're able to get the people that were actually interviewed. And it's interesting to know that when we are doing that phone survey, we never knew that COVID will come up. But in the wisdom of World Bank and the MBS that were doing it together, we collected the phone number of all the households that were interviewed then. Exactly when we started the third phase, the third wave. Because the first and second wave, we didn't have that idea about it. And COVID has not even come at all. But when we are doing the third wave, logically, we just collected the phone number. And that phone number now became an asset for us when we are actually doing the phone survey. Because we are going to get to them through the phone survey. So we don't need to go to them to see them. We just get that phone survey. We just get a phone and we call them and we got the interview done perfectly. But some of the areas that we actually thought the phone survey we are able to respond to, you can see from the slide, we have labor, mobility, and migration, youth aspiration, education, employment, access to basic services, up to household indebtedness. Next slide, please. Well, we always see it that there's an element of success in what you have done. And it's obvious from what you have on the slide there. If you look at it, even our staff, including myself, we're able to see that we are building continuous capacity for in MBS as a whole. And we have seen it. Even other surveys we have been doing after this COVID, our staff have seen the beauty of what innovation the COVID has brought. In terms of having continuous training, you see that every now and then, in fact, when I say we do the first phase, we have every month we have training. Imagine someone having training every month for 12 months. Automatically, you can think of the average of the knowledge the person will have gotten. We call them agents. They are middle-level staff, and they are very okay. So it makes them not to feel that, oh, okay, so with that now, even when somebody we are doing in the office now, we have learned so much from it that continuous training make a good thing that we get. And when we now see that after getting the training, to make sure that we didn't leave them doing the work, during the field work proper, that's the phone survey itself, we have to call back agents. Unknown to them, well, known to them, but not knowing they will call. So we just take example from what we have asked people from the field. The callback agents, we just call them to now review actually whether they actually do the thing. And you may know too that you are recording it. In other words, how are they actually doing it? Are they doing the interview correctly? So that's audio recording for them. And you cannot see the impact you have on all this. We touch this on now. People now were aware that even with this COVID, things can go on. And interestingly, to make it more practical, more genuine, my personally trained advocacy phone number was put into the questionnaire. So all the respondents from all over the country, either you are doubting or you are doing this, you are free to call me and I'm answering them that, oh, okay, it's true, and get it done. So with this zone now, within the shortest time, even the government, the Nigerian government was able to use that data to do so many things for policy within the shortest time. Next slide, please. Well, if those of us who are curious to know, there are so many people that have used the data, and interestingly, you can see several applications have used that's the National Digital Phone Survey data. More than 200 papers using Google Scholar statistics. Some of them you can see the name, you can see how you can even link them to see how you can get it done. So this is to show that the effect of what you have done actually have meaning, not only in Nigeria, even globally, because people visit the World Bank website, MBS website, and people have even called me outside the country to find out how we have done it, particularly the African country who actually want to know. As I'm talking, I told me about 2 or 3 countries I've called to either come and understudy what you have done, or for me to visit the place and tell them how to be done. So with this now, it gives us that privilege that yes, we have done the right thing. And to conclude it now, MBS is a National Statistical Office who coordinate the whole statistical operation in the whole country. So we cannot avoid not to do what you have done. And to now make it, we still use to thank the World Bank, because they actually supported us both technically and financially, either from the USAID or whatever, to get this thing done. And you can now see that National Statistics as a top data management office in the country, we continue to build a stronger synergy, especially in the use of modern technology to advance data collection in the wake of any eventuality. Although don't pray for this kind of COVID to come again, don't pray for multiple this or any other thing that come in time of this, it shows that you can always get away. With this, thank you very much.
Thank you, Mr. Tunde, for the presentation, really elaborating on the National Longitudinal Phone Survey and the experience. This is really helpful, and it's going to enrich the discussions during our event. And already some participants are putting questions into the chat, so perhaps you can have a look at those. And at the end, we will open up the floor for discussion. And I'm sure those in the room might have comments as well. So let me invite our next speaker and my colleague, Tatiana, who is a Statistics and Monitoring Specialist in the Data and Analytics section with UNICEF headquarters in New York. She's in charge of coordinating the Mix Plus initiative. She joined UNICEF in 2013 and worked on coordinating and technically supporting the design, implementation, and analysis of mixed surveys in Europe and Central Asia region, as well as in the DPR Korea. And before joining UNICEF, she worked for 6 years in the government sector on employment, monitoring and evaluation, macroeconomic research and forecasting, and as a teaching assistant in statistics at the Faculty of Agriculture at the University of Belgrade. So Tatiana, welcome, and over to you.
Thank you, Kiran. I hope you can hear me and see the presentation.
Yes, thank you.
Okay, great. First, good afternoon, good morning, good evening to everybody. It's really nice to be here and see people in person, to meet and discuss important things. I think this is my first event to see people in person. Anyway, let me first spend a minute or two just reminding ourselves about the MIX program. I know that many of you are familiar with MIX, but just a few things. MIX program, or Multiple Cluster Indicator Survey program, is a global survey program that started in mid-90s, and up to now we have concluded 348, actually, as from yesterday, 349 surveys in more than 100 countries during this huge number of years. MIX, it comes in rounds, and we started first round back in mid-90s. Each round is about 5 years, and the latest 6th round includes the largest number of surveys for many, many reasons, but many of them have to do with excitement around SDGs. As you can see on the right side of the screen, we have around 80 indicators, the SDG indicators that can be actually covered or calculated from household surveys, and MIX is covering almost half of them. In the middle of the screen, you can see some facts from the 6th rounds. So we have 75 surveys. We have 177 core indicators, including SDGs. And the average sample size around the world is around 1200,000 households. We conduct mixes face-to-face survey using computer-assisted personal interviews. So copy. All surveys are copy surveys. We don't, in sixth round, we don't have even one survey conducted on paper. So back in 2019, with an expert group meeting and a pilot in Belize, we initiated a new tool called Mix Plus. Mix Plus is a longitudinal representative household survey tool with interviews conducted over the phone. I mentioned Mix also because it's important for Mix Plus because it builds on 25 years of experience of the Mix program. So Mix Plus collects data preferably on the situation of children, families, and households on frequent basis and with near real-time reporting. So let's see how we are conducting Mix Plus. First, we choose the sampling frame, and the whole methodology is based on idea to use a conducted mix in the country and use it as a sampling frame, of course, with collected phone numbers. But not all countries are conducting mix. So basically, Mix Plus can be used in countries that have a good register, household-based register, or some other nationally representative survey with the phone numbers. So once when we have sampling frame, we select a representative subsample. Having in mind the fact that we already, as a sampling frame, have nationally representative frame, also subsample is nationally representative. The next phase, we establish the call center or data management system, the whole infrastructure, if doesn't exist in the NSO. We have two subsystems, central office for project administration and monitoring, and of course, interviews part. Important thing to mention here is that it's very flexible. So it can be conducted with just having a simple tablets and phones. And of course, in some countries, there are very sophisticated call centers that can also be used and have, of course, their advantages. So once these are done, we actually starting to place calls to the households. We collect data, transfer data to the cloud, and all is captured by the data management system. What is different compared to most surveys conducted over the phone, that we are using substitution, which I will mention more in next slide, explain more. But basically, after we collect data from all sampled households, of course, there will always be some households that we are not able to reach for different reasons. So substitution is a way how we are dealing with that part. And then, of course, once when all data are collected, we analyze in report. We use SPSS, but of course, it's possible to use any other statistical software. We tabulate, we prepare dashboards, snapshots, tables, whatever country prefers. So just once when we finish with that, similar like Talib mentioned, we are of course placing calls in 1 month or 2 months, depending on the country planning and needs. And usually we are doing it over a period of 1 year. So what is substitution? What we are doing? Once when data collection, we call the selected households and we finalize the data collection. As I mentioned, it will always be some households that we cannot reach for different reasons. We analyze the data and we select the households that cannot be reached. Then, using the Euclidean distance analysis called nearest neighbor, it's a function in SPSS, but of course exists in other statistical softwares, we create a model using variables on household characteristic available in the sampling frame. So this is the important thing because, as I mentioned, we use sampling frame based on households, and preferably they should have as much as possible household characteristics there. So when we create a model, we run the model and we select a new household. So we replace the households that we could not reach. What we are trying to do is to find most identical or similar households to replace non-responding households. And then we place direct calls to those new selected households. Until now, there was a need to perform substitution only in the first wave of data collection, and this gave us really high response rates. So in short, what is Mix Plus? So we have multiple interviews conducted over the same households at regular intervals for a period of 12 months. So we have longitudinal representative data. Telephone interviews are conducted with one knowledgeable adult household member. So we ask one person about everything in the households, including questions related to selected children. Main focus, again, is on children, education, health, nutrition, child protection, and more. Until now, we had really high response rates from the beginning to the end of the mixed surveys in countries. It's, of course, with low cost, and it's real-time data collection compared to face-to-face surveys. And when established in the country, of course, the country can respond very fast to any emergence needs. It can be used for different purposes, to generate cross-sectional or longitudinal data for monitoring, program indicators, measures conducted in the country, for opinion polling, for crisis monitoring, and of course, we are using it in some cases for testing some new questions and new modules to see how it will work when we collect data over the phone. Until now, we fully completed 2 surveys in Georgia and Mongolia. Mongolia was the first country implementing the Mix Plus on national level. You will hear more about Mongolia in the next presentation. Mongolia continued to implement Mix Plus. We also started in Samoa. We are in design phase in Nigeria and currently planning in Jamaica and Vietnam. So as I mentioned, implementation of full-scale Mix Plus started in 2020. Now we are encouraging all future mixed surveys to collect phone numbers and consent to conduct Mix Plus. So we have more and more countries wanted to join a program. And we have very important methodological work in progress, and initial results shows that the sample implementation strategy that we are using, substitution, this matching or conditional substitution, is very efficient and produce representative and unbiased data. We are also trying to analyze how this is influenced. In a phone surveys is always difficult to cover all vulnerable groups. So we are now analyzing how our approach is basically influencing that part of the problem. And of course, when we talk about dissemination, we have dashboards, snapshots, Excel tables, and all microdata are available. Usually we are publish microdata after every 3 waves in the country. You can find all materials, including on manual, on how conduct Mix Plus, on Mix web page. We have Mix website, and then you will find their Mix Plus web page and on web pages of national statistical offices. So that's all for now. I hope I didn't take too much time. Thank you very much.
Thank you so much, Tatiana. It's very interesting, seeing this continual innovation for the Mix program. The Mix Plus really building on 25 years of experience in the Mix survey program. And I'm sure there'll be some questions, some already in the chat. So please do consider those as we come to our final speaker. So Mr. Batmunk has been appointed as the chairman of the National Statistics Office of Mongolia in January of last year. And before his appointment, he served as the Director General of Research and Statistics Department, the Markets Department, and Balance of Payments, Research and Statistics Division of the Bank of Mongolia. He earned his master's degree in banking and finance from the Luxembourg School of Finance at the University of Luxembourg. He also has a bachelor's degree in business administration from Ming Chow University, and he earned a chartered financial analyst charter holder in September of 2019. So, Mr. Mapung, welcome, and over to you. Hopefully you can keep to 10 minutes. Thank you.
Thank you very much, moderator. So first of all, I would like to thank the UNICEF for allowing Mongolia to share our experiences in conducting Mix Plus. Next slide, please. So this is the content of my presentation. First, I will touch briefly upon the need for high-frequency data, and then I will touch upon some of the examples of the telephone surveys that we have conducted in Mongolia. Then, of course, I will try to elaborate more on the Mix Plus Mongolia experience, including the sampling frame and also the call centers that we used. And then also I will touch upon the advantages, limitations, and challenges of the telephone service, which is the main focus that we're going to talk today. So as you all experienced during the COVID-19 pandemic, due to the strict lockdown, we were not able to visit the households to conduct the in-person surveys. But at the same time, the high-frequency data, or demand for high-frequency data increased for the decision makers to help them to understand the situation of the households during the COVID-19, and then how the government policies or government reactions against the COVID-19 is affecting their livelihood. So for this reason, with the help from the UNICEF, we have started waves of Mix Plus surveys starting from the September 2020. Next slide, please. Besides Mix Plus surveys, we have conducted other telephone-based surveys since the start of the pandemic, including the ICT usage in Mongolia, effect of COVID-19 on households, and gender and environment. Next slide, please. So let me touch upon the how we used our call center during the lockdown period. During the normal time, as you would all expect, our operators would be, using our call centers from the office normally. But during the strict lockdown, we provided our operators to use Internet VPN to securely connect our call centers using the Internet service provider. So this enabled our operators to operate from their home during the lockdown period. Next slide, please. So now let me move into the sampling frame for Mix Plus Mongolia. We have a population registry, which we call the Household and Population Database in Mongolia, which contains the phone numbers of the households. And the frame which we used for the Mix Plus was updated in January 2020. And telephone survey in case of Mongolia was easier for us because our 95% of households have phone numbers. And in terms of the sampling, we used the stratified random selection using the regional representation and the capital city in the sample design. And for the validation process to increase the coverage and reduce the non-response issues, we used several stages. First, phone numbers of the selected households were sent to the mobile operators to clarify whether the phone numbers are active or not. And secondly, this list of the samples, the households with the phone numbers were sent to the local statistical offices to ensure that the relevant phone numbers were correct. And during the survey, if we find out there's not non-answering phone numbers or not valid phone numbers or switch of phone numbers, we would send the list of households with the phone numbers to the local governors to help us to substitute the phone numbers and help us to obtain new phone numbers. So this helped us to increase the coverage of the mixed class surveys. And now, in terms of the advantage of telephone surveys, as Tatiana said, it's less costly compared to the traditional survey, so we can reach a wide geographic area, especially in case of Mongolia, where population density is very low with a bigger landmass. And of course, the rapid data collection, near frequent data processing using the CATI system is one of the main advantages. And we were able to create panel data based on the mixed waves of the mixed class surveys. And also the quality control can be assured using the recording of the telephone interviews. And of course, the people who responded felt greater anonymity than the personal interviews. And one of the good thing about the telephone surveys is that we could adapt to the questionnaire to the changing data needs. Next slide, please. And now, as for the limitations of the telephone surveys, one of the main issues was we were mostly able to talk to only one member of the family who responded by the phone. So this creates a representation issue at the household, and there was also inattentiveness issues, and also the respondents could terminate interview at any time compared to the traditional in-person interviews. And also the lack of visual materials or non-verbal cues also created a problem. And we had to keep the interview short due to the time constraints limited for the telephone surveys. Next slide, please. And as for the challenges, designing the questionnaire consumed as much as time as with the traditional surveys because we had to consult with multidisciplinary experts. And the trust in telephone surveys, we find it's low, could be lower than the traditional in-person surveys because public does not trust if the one is calling from the statistical office. And one of the things we find interesting finding that we have found is that prepaid phone numbers owners, they change their phone numbers a lot. So it was harder for us to find the correct number. So we had to go through those validation steps. And overall, we have conducted 7 waves of the mixed class surveys, and we are now processing the 8th wave. And during these waves, we collected the information specifically on the effect of the COVID-19 on the household and children. And wave 1, 3, and 6 were mostly focused on the distance learning, and also the wave 2 was on the nutrition and then also the household water supply. So you can access to the survey results and the survey materials using the links shown below. I think the slide is going to be shared after the presentation. Now let me share some of the results of the mixed class survey. So as you can see from these results of the water and sanitation from the mixed class, you can see that those poorest percentile of the households struggled more during the COVID-19. You can see that their households with improved sources of drinking water and basic drinking water services have dropped during the COVID-19 compared to the other income percentiles. Next slide. And in terms of the result of the change in the body weight of the children aging 10 to 19, we can see that there's also significant difference between the richest percentile and the poorest percentile on the right side of the chart. So this is the presentation we would like to share at this event. So thank you very much. Over to you, Karen.
Wonderful. Thank you so much. That was really a rich experience Mongolia had with the Mix Plus, as well as other telephone survey experience. And, the slide on limitations and challenges was very, very helpful. So colleagues, looking into the chat, I think all of the questions have been answered. There's been a nice exchange back and forth, but maybe we'll open it up to the colleagues in the room who didn't have a chance perhaps to add into the chat, or anyone online that would like to take the floor. We have a few more minutes remaining.
Thank you. Just a quick question to anyone who presented. I understand that, as mentioned by my colleague from Mongolia, prepaid numbers usually would change a lot. That also happens in our country. So I just like to note to ask how large is the replacement rate due to the phone is already unavailable. It means that it has a new number from your experience.
So,
Can I?
Okay, so sorry, Tatiana, you can go first. Yeah.
Yeah, thank you. So in Mix Plus, at least according to our experience until now, we have this problem in the first wave. Because I will give you an example. It's similar happened in Mongolia and in Georgia. In Mongolia with lower extent, because Mongolia update the register regularly, but basically between the time of the household survey where we collect the data until time we conduct the Mix Plus, of course, some numbers will change. That's why we are trying to solve this with substitution and to find households which similar or identical characteristics that we can reach. But then in following waves of data collection, we are at the end of each interview, we are asking our respondents to provide us the phone number that they plan to use in the future, or to give us how we can contact them in 1 month. And this worked well until now. So this is one of the ways how we are doing it. Over.
As for the question from my colleague from Philippines, I would say around 20% of the household, we have to do this validation process.
There's two other questions online. One is about, a platform that enables the collecting of SMS voicemail data in the field. I know this question has been asked. Do any of the panelists have experience with that? So maybe, Habiba, we will have to try to get back to you if we can find anything on that. And then Naki is asking about if we have any ideas of the remote areas out of telecommunication coverage. I imagine the mobile network operators have very detailed maps, but maybe one of the colleagues would like to come in on that. Do any of the panelists have experience? Please tell it.
Okay, so maybe I'll just briefly chime in. So in general, I guess with the implementation of the phone survey, similar questions have risen in the chat, maybe a concern for others that are thinking about similar efforts, which is around representation. To what degree can we reach underprivileged, underserved subpopulations in a given country? That may be correlated with remoteness, which again may also be correlated with other societal issues, high levels of poverty, or other inequities that may translate into inequities in cell phone use. So obviously, these are all correlated factors, and they also have some bearing on people's access to mobile networks and their use with cell phones. So in general, we follow a few different kind of steps. So one, if we have phone numbers available, obviously for a person that has been selected for the phone survey, we have a protocol in place that systematically gives callbacks to reach individuals. Second, oftentimes, because we've used pre-COVID-19 face-to-face surveys and they've tended to be longitudinal surveys, we actually have phone numbers for other members of the household. So we try to reach those numbers as well. But to the extent that these coverage issues are systematic, in a given survey round, even within the callback implementation protocol that you follow, which is fairly rigorous for us, a number in a given round gets a callback about 9 times during a span of about 6 days. And these are like systematically distributed throughout the day. We may not be able to reach a person for various reasons, right? We also may not be able to reach people because they don't have a cell phone in the first place. So whatever the reason is, the way that we have dealt with it, round in and round out, was to calibrate these sampling weights in a way that counteract these coverage and non-response biases. And the way that we've been able to do it is to take advantage of pre-COVID-19, I guess, face-to-face survey data on all households, even including the ones that we cannot observe in phone surveys for various reasons. So I've included some resources on that, linked to the work that we've done. But yes, it is a concern, and there are some structural issues that phone surveys in lower income contexts can still not get around. Okay, over to you, Karen.
Thank you so much. Any other colleagues want to come in to take the floor or in the chat?
Yeah,
Please, Tatiana.
maybe I can say a few words. Yeah, this can be a big issue, and as Talib mentioned, there are different ways of how we can deal with this kind of bias. I mentioned during my presentation that we are analyzing the collected data, mainly now focused for Georgia, because in Georgia we used Mix Plus as a sampling frame. So similar as Talib mentioned, we have already data there for all households, even those without the phone. So now we are trying to analyze and to test what would happen if those households would actually respond to our surveys, if we were able to reach them, and how this would influence the overall results, and comparing that with the methodology that we are using, together with the approach using propensity scores and calibration and everything. I really hope that the paper will be available in the next month or maximum 2. So yeah, we will be able to see the results and the effectiveness of the methodology. Of course, with more countries coming and joining the program, we will have more evidence on all these issues.
And Tatiana, do you want to take this question in the chat about how do you arrange? Oh, sorry, please.
So yes, yes. Talib have said something that I actually want to say. In Nigeria, just as the Mongolia was saying, when we are collecting the phone, we didn't limit it to the household. We collected from neighbors, about 3 people, so that even if we are to trace you, if your own is not going, there's a way that those neighbors will find us to get you. So it makes it very seamless for us. That's one. Then 2, in Nigeria, we have multi networks, about almost 10 different networks. So hardly in Nigeria today, we now have at least a phone going through. So we call it hard to reach here. That's hard to reach areas. But notwithstanding, we have found out that all our surveys have to do with phone survey. Because we have so many networks, we are always getting there. We are always getting done. So, but the finality of it is that in case of not going, we give room. Just like I've said it, we give room for. You don't just call once or twice and say you forgot. No, up to 6 times within a range of time, so that no matter how you're able to get the person. But because of the fact that we allow a substitution or replacement, if you can't get the neighbors, we get you, and with that, we got the thing done. Mostly of the work we have done, almost more than 90% response rate we have achieved. But the phone survey, to some large extent, as we are going, the thing reducing, shrinking, which is expected, different from the. So in other words, the response rate for the survey, from phone survey, is slightly less than the face-to-face. Thank you very much.
Thank you, Mr. Tunde. So colleagues, anyone else would like to come in? We have just a few more moments before we should let people go on.
Kiran, I would like to answer to this last question,
Please.
How we arrange substitution with interviewers. So when the initial data collection is done, we spend a day or two to run the substitution model. We select the new households, and then we assign them to the interviewers. So it's not done immediately after we let's say we cannot reach household, and then we immediately substitute. We try to reach the households until the end of data collection. And then once we are sure we cannot reach them, we select the whole households that we could not reach, and then run the model.
No, thank you so much. And I'm sure there's a lot of documentation that colleagues can read. Maybe the last question from Hadia. How to ensure the same person will not be interviewed through a telephone, because there's a possibility, some people have two telephone numbers, different mobile operators perhaps. Do any of the panelists have experience with that?
Yeah, this is, there is some, because we are using mobile phone surveys. Yeah, there are different types of mobile phone surveys, but all of our surveys are household based. So we are not selecting mobile phone from the sample. We are selecting households with phone numbers. So in our sampling frames, all households can have one phone number, can have 5. So basically, we are reaching households, not a mobile phone or a person behind that mobile phone.
And maybe one last question on, do we have to give incentives to participate?
This, at least for us, it depends from country to country. Definitely, it's not universal response to that.
Yeah, if I may, in case of Mongolia, we do provide incentives to the households for participating in the survey.
Yes, for us in Nigeria too, but in our own case, we send airtime. When we do the first phase, it was 500 naira airtime once you allow us to interview you. But we now see that the team has a way of getting them want to respond. So during the second phase, now we now increase it to 1,000, which is actually paying off for us. Thank you.
Wonderful. I'm sorry, Telef, I think you wanted to come in, but then we should close.
No, it's fine. Yeah, I think it's been well tackled. So I shared some resources in the chat too, and obviously the participants in the room don't see those, but these questions around incentives and interview durations, we've done some cross-country analyses and published with those. So if you go to our website, you'll have those resources. But I see that the presentation slides will also be shared. So.
Wonderful, that's fantastic. Thank you so much to all 4 of the panelists and to the participants, both online and in the room. It was very, very stimulating, and I'm sure we could have gone on more, but I'm afraid we should stick to our time. So thank you.